Awesome. Hi, everyone. Thanks for being here today. My name is Sophia. I'm a program manager at Asian Women for Health. And we've been having these amazing monthly workshops to talk about the different stigmatized health topics in our communities. And today we will be talking about addiction and recovery. And I'm so excited to have Anise help with us here again. They're amazing. So if anyone wants to go into, get therapy or go into counseling, definitely check out Anise Health. They're amazing. Um, just really quickly, Asian for Health, we are a nonprofit dedicated to advancing the health and well-being of Asian women and people from diverse, underrepresented backgrounds through community engagement, education, and representation. So you'll see on the screen some of the events that we've had and different outreach events that we've attended in our communities. From these workshops, we turn them into resource guides so that everyone is able to access all the information that we want to share with our community. Also, really quickly, I always like to make sure that people are up to date with the vaccines that are out there. So there is a new COVID-19 vaccine that's currently out. I know at the end of the month, people are allowed to order more at-home COVID test kits for free through the CDC, I believe. So definitely keep an eye out for that. But COVID rates are still on the rise. So definitely remember to get your COVID vaccine and keep yourself and your loved ones safe. And with that being said, I will pass it over to Angel.
Sophia, it's so lovely to see this community. It's a really special group, and big shout out to Sophia for promoting all of these psychoeducational resources. Today, we're going to be talking about addiction and recovery and healing together in the Asian community specifically. We know this is a topic that can feel sensitive and personal, and we encourage, in those times of discomfort to lean in to each other and, to be open and honest. We do have the pleasure of having this session facilitated by one of Anise Health's clinical directors, Jennifer O. She has actually spoken in the past too before about another topic, and it's so lovely to come back together. Yeah, so I will turn it over to her in a moment. Just wanted to share Anise Health provides culturally informed mental health care for people of Asian descent specifically. So with that, I'll turn it over to Jennifer to introduce herself.
Hello, everyone. My name is Jennifer. I'm a licensed clinical social worker specializing in working with complex trauma with Asian American adults. I use a lot of my evidence-based interventions such as EMDR and DBT to kind of support. I also really enjoy talking about this topic. I was a clinical coach for substance use clients for a very long time. And so this is a very helpful topic, so I'm excited to spend this time with you guys.
And we have a special treat for everyone here, which is the first half of our presentation today will be focused on addiction and recovery. And the last 20-ish minutes will be about more information and training about how to respond to overdoses. So including narcan and naloxone training. Daniel Cruz is joining us today from ADA, the Asian American Drug Assistance Program. And so this will be great for us to have all of those components combined, and also just introduce Daniel at the end of our workshop. So if you have any questions, feel free to drop into the chat. Just want to let everyone know that if there's any lingering discomfort, this is not a substitute for professional care. So we'd encourage everyone to reach out to professionals if there's any lingering discomfort. So with that, we'll turn it over to Jennifer.
Thank you. All right, so before we begin, I guess it would be helpful for us to kind of get an understanding of what is addiction. Addiction, whether to substances or behaviors, is a very complex issue that impacts individuals all across demographics, including Asian Americans. It often serves as a coping mechanism for underlying emotional pain or as a way to seek our fleeting feelings of discomfort or happiness through chemical releases like dopamine and serotonin. While addiction has biological underpinnings, it is often misunderstood, leading to stigma and social consequences. According to the DSM-5, addiction is defined as a chronic disorder characterized by compulsive substance use or behavior, difficulty in controlling its use despite harmful consequences, and a strong desire to engage in the behavior or substance use. The DSM-5 recognizes both substance addiction, like drugs and alcohol, and behavioral addiction, like gambling, food, or excessive use of technology. The substance addiction involves the compulsive use of drugs or alcohol, leading to physical dependency and withdrawal symptoms, and substances like opioids, stimulants, and alcohol fall into this category. Behavioral addiction includes compulsive behaviors that don't involve substances but lead to very similar consequences. Some examples include gambling, excessive gaming, overeating, workaholism, sex, and even love. These behaviors may not induce the physical withdrawal, but they affect the brain's reward system in the same way. And so both of these forms of addiction share some commonalities. They serve to soothe the emotions, escape painful realities, or temporarily generate positive feelings through the chemical process. There are some statistics of addiction in Asian Americans. Although Asian Americans are often studied as single population, there are important differences in the rates of substance abuse among different Asian subgroups. 1.6 million Asian Americans over the age of 13 had a substance use disorder in 2023. 14.7% of Asian Americans engage in binge drinking, and 3.8% have alcohol use disorder. 27.6% of Asian Americans reported lifetime illicit drug use compared to 55% in Caucasian Americans. 46% African Americans and 38% in Hispanic Americans. However, AAPI tend to have a higher risk of gambling addiction than the other groups. So some of the Asian populations that have subgrouped of this statistic is that Japanese Americans have the highest rate of binge drinking, and Chinese Americans have the lowest. Korean Americans have the highest rate of heavy drinking, and Chinese Americans have the lowest. Japanese Americans have the highest rate of cigarette smoking, and Chinese Americans have the lowest. Korean Americans have the highest rate of marijuana use, and Chinese Americans have the lowest. So there's also different types of subgroups, and often shows that actually there's a lot actually of addiction happening in our Asian American culture. Stigma around addiction is actually one of the biggest barriers to treatment and recovery, making it harder for individuals to seek help, receive support, or even admit that they have a problem. Addiction, especially substance use disorder, is often viewed as a moral failing or personal weakness, rather than a medical condition that affects the brain and behavior. Stigma refers to negative beliefs, attitudes, and stereotypes that society holds toward a particular group of people. And in case of addiction, this often involves misconception about why people become addicted, what kind of people become addicted, and how easily they should be able to stop. And so some of the stigma can come in different forms. There's a public stigma where the general public has a negative perception and discrimination against people with addiction. There's the self-stigma where people with addiction internalize some of these negative beliefs that the society holds about them, leading to immense feelings of shame and hopelessness. There is the structural stigma where there are policies or practices within institutions such as healthcare systems or legal frameworks that make it hard for people with addiction to access help. Now, stigma is often reinforced by the language people use when talking about addiction. So terms like junkie or addict or alcoholic, or phrases like you need to get clean or you just hit rock bottom, they carry very harsh connotations and reinforce these type of negative stereotypes. And these labels would reduce the person's identity to their addiction, overshadowing their humanity and their own struggles. So some of the few common misconceptions that contribute to this stigma is that addiction is a choice. A lot of people believe that addiction is a simple matter of poor willpower or bad decision making, and this misconception overlooks the fact that addiction changes the brain chemistry, making it extremely difficult for individuals to stop the behavior without help. So I'm sure a lot of Asian Americans, I believe young Asian Americans experience this from family where it feels like their parents are just telling them to stop, or it feels like it is a choice, and that can cause a lot of disconnect within themselves and lower self-esteem. There's also, again, this phrase of like, you should be just able to stop. People often want to stop if they could, but not realizing that addiction involves very complex neurological changes, really impair their judgment, impulse control, and decision making. Another misconception about addiction that contribute to stigma is that people with addiction are dangerous or untrustworthy. There's often an assumption that these individuals are inherently irresponsible, and this stereotype not only dehumanizes them, but also leads to social isolation and further discrimination. So the stigma surrounding the addiction has very negative impact on people trying to recover. It contributes to feelings of shame, isolation, and hopelessness. And some of the impact that they have is the fear of seeking help. A lot of the damaging consequences of stigma is that it prevents people from seeking the right treatment. They might fear being judged by a healthcare provider or friend or family, so they hide their addiction rather than asking for help. They might feel really ashamed about their struggles or fear that they might lose their jobs or relationship or their immigration status or social standing if they have to admit that this is something that they are struggling with. The biggest stigma too around institutions are healthcare stigma. A lot of times people avoid seeking medical help because of their past experiences of being treated poorly or judged by a healthcare professional. They might sometimes encounter very dismissive attitudes or feel like they're not being taken seriously. Another impact is that people with addiction internalize again the negative stereotype, and it leads to intense self-stigma. They begin to believe that they are worthless or weak or undeserving of help, and that creates a vicious cycle. And it creates immense feelings of guilt about their behaviors, especially when it impacts their loved ones. And so it feels like they failed morally, which can actually push them deeper into the addiction as a way to cope with some of these difficult feelings. And so one of the ways to reduce stigma is by changing some of the language that we use. So terms, instead of saying you're a junkie or you're an addict, terms like person with a substance use disorder or person in recovery are more humanizing than those more harsher connotating terms. And these terms highlight that the addiction is a condition that the person has rather than their identity or who they are. So using person first language helps that they are more than the addiction. And this small shift can actually help reduce judgment and treat addiction as a health issue rather than a character flaw. I know we talk a lot, when we think about addiction, we often think a lot about substance. And so I wanted to also share a little bit about behavioral addiction. So signs of behavioral addiction is also their inability to stop or control their behavior despite knowing their consequences. They feel extreme shame or embarrassment after doing the activity. They tend to do more risk-taking or increasing risky activities, needing more exposure to feel the highs, experiencing cravings, or using the activity to justify dealing with poor mental health. So a very common behavioral addiction is eating, love, sex, again, gambling, even working a lot. These are all behavioral addiction. I think the biggest thing to note is if it happens just like one day where I'm like, oh my gosh, I just ate a lot and I didn't have control, it doesn't really count as behavioral addiction. It has to be this identity or this feeling of lack of control. And as a result, feeling like it's impacting your functioning in your daily life, so your work or in your social life. So again, it's really important to understand what addiction is in terms of the brain. Addiction is a brain disease. It's helpful to think of the brain as a very highly complex yet delicate system. And addiction fundamentally changes how the brain works, particularly in how it experiences pleasure and rewards. The human brain has a built-in reward system that's responsible for making us feel good. And when we do things necessary for survival, like eating or socializing, and when you do something pleasurable, the brain releases chemicals called neurotransmitters. And the most important one that we want to focus on is the dopamine, often referred to as the feel-good chemical. It creates a sense of pleasure and it helps reinforce behaviors by making you want to do them again. So for example, let's say you enjoy a delicious meal. I know Sophia and we were talking about boba before, but when you drink boba, your brain releases dopamine and it gives you a pleasurable feeling and it says, wow, that was so good. I'm going to drink it again, right? And some people might start drinking that same boba every single day and then it starts to impact their bank account. And so, yes, boba addiction is very real. Now, when someone uses the addictive substance or engages in addictive behavior, such as drinking boba, for this example, the brain is flooded with unusually large amounts of dopamine. And the dopamine surge overwhelms the reward system. It creates an intense feeling of pleasure and or a high, yes. But here's the problem, the brain is always trying to find balance. It's always trying to maintain balance. And when it gets too much dopamine, it's trying to adjust the amount of dopamine coming into our brain. And there are two things that happen. The first thing is tolerance, right? The brain reduces its response to the dopamine, and now the person needs more of the substance or more of the behavior to frequently feel the same effect. So what used to give them pleasure no longer feels as satisfying. So if we were to use the shopping, maybe buying one thing, maybe used to give the same high, but now I have to spend this much to kind of get the same high. So your tolerance kind of becomes bigger and bigger to respond to its dopamine balance. The second thing that happens is the desensitization. Everyday activities like spending time with loved ones or enjoying hobbies, things that are very slow, actually tend to no longer release enough dopamine to feel good. This is why people with addiction may start to lose interest in the things that they used to enjoy. So addiction begins to then shift from a choice to a compulsion, and that person may no longer feel that they have control over their actions. That's because addiction begins to change the brain and its way of making decisions. And that part of the brain responsible for logical thinking and self-control is the prefrontal cortex. That becomes impaired during this addiction cycle. The addiction essentially hijacks this part of the brain, making it hard for people to stop. And even though they know that it's harmful, they may feel extreme powerlessness to stop. And so additionally, the brain begins to associate certain triggers like places, people, or emotions with the behavior or the substance, leading to cravings where the brain urges a person to seek out the behavior or substance to relieve the craving. So again, if we talk about the boba, maybe I know that this boba shop is in this street. I'm gonna drive by it, and your brain starts to recognize the area, and your mouth starts to water, and it's like, I need to have this boba, and we'll probably make a stop. An addiction cycle can look like I have a very important meeting that I need to get to, but this intense craving of a boba is so intense that I do have to make a stop, which might lead to maybe not making it to the meeting. So that's an example of how it might really impact their work or their social functioning. To sum it up, addiction can be understood through the lens of the 4 Cs. I'm going to explain maybe the 4 Cs with the example of somebody who is addicted to work. The compulsion is the irresistible urge to engage in a behavior. A person who is addicted to work might feel constant compulsion to work, even during times when work isn't required, such as weekends or vacations. They might feel compelled to check their emails or complete tasks when they're physically and mentally exhausted. And this compulsion can stem from a fear of falling behind or a belief that they need to prove their worth by working excessively. It moves on to then the craving, which is the intense desire to or urge to use a substance or perform the addictive behavior. So if somebody who is addicted to work experience a craving to work, especially when they feel anxious, when they feel stressed or uncertain, during moments of downtime, instead of doing something fun, they may feel restless or driven to check in on their project or catch up on their task, even when they have planned to rest. So their mind is often preoccupied with work. They may feel uncomfortable or guilty for not being productive. So the consequences of that is the continued use of this harmful behavior can lead to harmful consequences like damaged relationships or legal issues or health problems. A person with overworking addiction might keep working excessively even though it's negatively impacting their personal life. They may miss family events, skip meals, and suffer from burnout. They might have chronic stress or health issues like high blood pressure. Despite knowing that overworking is damaging their health and relationships, they continue to prioritize work over other aspects of life. And the last part is the control, the loss of control over the use of the substance or engagement in the behavior. A person with addiction to work might repeatedly tell themselves and others that they're going to cut back or they're going to set boundaries, but they consistently lose control of it or end up working late despite wanting to set these boundaries. And when they try to take breaks or spend time with family, they feel drawn to the work task, unable to really fully disconnect mentally and physically. They might have difficulty delegating or saying no to additional responsibilities, which might then perpetuate the cycle. So just like heart disease or diabetes, addiction is considered a chronic disease because it creates long-lasting changes in the brain. The reward system, once hijacked by the addiction, can take months or even years to heal. This is why recovery is often a very long-term process, requiring ongoing support, in some cases, a medical intervention. Now, when somebody develops addiction, their brain is primed to seek out the substance or behavior again, even after a long period of abstinence. This is why relapse is very common. It's not a sign of failure, but rather a symptom of kind of the chronic nature of the addiction. Now, when discussing addiction, it's also important to recognize that many people don't just struggle with substance use or addictive behaviors alone. It's a significant number of individuals with addiction also experience mental health disorders. This is what we call co-occurring disorders or dual diagnosis, where both a mental health condition and an addiction exist simultaneously. So understanding the relationship between mental health and addiction is key to providing comprehensive care. Often these two fuel each other in a vicious cycle, making treatment very challenging, but also very necessary. Some common mental health conditions that frequently co-occur with addiction include depression. They often use substances to feel very temporary, but they exacerbate depressive symptoms over time. Anxiety disorders, they may turn to addictive behaviors or substances to calm their nerves. Again, very short term, but it can lead to dependence or withdrawal, can actually make the anxiety symptoms worse. PTSD, individuals with PTSD often use substances to manage their flashbacks or hypervigilance or emotional numbness. Addiction can worsen actually the emotional dysregulation and then prevent effective trauma reprocessing, making recovery more difficult. Again, it's a very complex and bi-directional relationship with addiction and mental health. They can lead to the other or they can develop together. Addiction becomes a self-medication. People with mental health disorders often turn to it to manage their symptoms. Addiction can also worsen mental health. The long use of the behaviors or the substance can deepen the feelings of the symptoms or the depression. And both addiction and mental health disorders often share very common risk factors, including genetics. If a person has family history of mental illness or addiction, increases their risk for both. Somebody who experienced trauma, whether emotional, physical, or sexual, can trigger both addiction and mental health issues. Chronic stress, whether from personal relationship, work, or life circumstances, can also contribute to both mental health struggles and addictive behaviors. When it comes to overcoming addiction or recovery work, it's actually really important for us to understand that change doesn't happen overnight. Addiction is very complex, it's a chronic condition, and recovery is a very long and gradual process. And one of the most useful tools that we have for understanding this process is actually called the stages of change model. This framework helps identify where someone is in their journey of recovery, and it helps to acknowledge that this change is not linear. People may move back and forth between the stages, and setbacks are very common. So understanding these stages can allow both a person struggling with addiction and those supporting them to respond appropriately and offer the right kind of help at this right time. This stages of change actually was created, I think, back in the 70s to help with people who were dealing with cigarette addiction. So this helps to kind of apply to almost all type of behaviors, behavioral change. And this is something that a lot of therapists use in their interventions to help somebody with their recovery. So the pre-contemplation stage is essentially somebody who is not ready to change. At this time, the person doesn't see that the behavior is a problem. They might be in denial about the negative consequences of their addiction, or simply unaware that the action or their actions are causing harm. So it's common to hear things like, I don't have a problem, or I can quit anytime that I want. The goal of this stage for people supporting people in this recovery is we want to raise awareness. friends, family, and healthcare providers should gently highlight the impacts of the addiction, but without judgment or pressure. So sometimes very open-ended questions can help the person explore more of their behaviors and understand the impact of that. Contemplation stage is considering change. Person begins to acknowledge that their behavior may be problematic, but they're not committed to change yet. They might weigh the pros and cons to continuing the addiction. So things like, I know my drinking is bad for my health, but it helps me to relax. So I'm just going to keep doing it. They feel a little bit of confliction and they recognize the negative effects, but they're not really ready for change yet. At this time, it's really helpful for us to encourage a reflection. Help the person explore the benefit of change while addressing their fears and concerns. The stage is about building up their internal motivation to shift from thinking to doing. Then we get to the preparation stage. This is where people get ready for change. This is somebody who has decided they want to make changes and they want to start small and concrete steps towards the goal. So they might start researching treatment options. They might start talking to friends. They might start talking to counselors, or even setting a quit day. I'm going to do it by this time this year. At this point, they're mentally preparing themselves for the challenge of breaking free from the addiction. So at this time, we want to help them develop a clear action plan. So this might involve very specific goals, finding support groups, or identifying triggers that could lead to relapse. This is the time to encourage self-efficacy. We want to build their confidence that they can do it, because oftentimes they're feeling scared to make this action because they know that it's going to be painful. So we want to encourage them, build their confidence. The fourth stage is the action. This is now where real change begins to happen. The person starts to actively work and quit their addiction. They might begin therapy. They might start attending rehab program or join a support group. During this stage, they're fully engaged in modifying their behaviors and managing the challenges of withdrawal, cravings, and potential triggers. At this time, it's really important for people to provide ongoing support and encouragement. We want to help the person stay focused on their goals and celebrate even small successes, no matter how small or how big they are. Again, relapses can happen, and if they do, focus on learning from the experience. Help them to re-strategize and refocus on their goal rather than viewing it as a failure, which can intensify kind of their low self-esteem or guilt or frustration. Maintenance is where they begin to sustain this change. They have successfully made the change and now is focused on maintaining it. It's about long-term recovery and preventing the relapse. They may start to build new routines, new relationships, continuing to attend support groups or therapy sessions to help them stay on track. So at this time, it's helpful for people to support them by maintaining the coping strategies, understanding the triggers, maintaining open communication, access to these support systems can help navigate this stage successfully. Again, relapse is not a failure. It's an ongoing process. If people go from maintenance to back to action, it's not the end. It's just because they went backwards, it doesn't mean that they failed. Again, part of the long-term recovery is that there's going to be movement. People can go from 6 to 4 to 3 and then back to 1. So it's really important that they're not feeling guilt or frustration and that it's an opportunity to learn. So when they experience a step back, help them come back to the preparation or the action stage to identify, hey, what happened here? What didn't go well? What can we do to re-strategize a goal and prepare again for you to go back into the action? So again, matching the treatment and the intervention to the person stage can make it more effective, and it meets them where they are rather than trying to force them into something that they're not ready. So I know that, Sophia, you asked the question of how do you support someone who may not acknowledge their addiction? So that shows that they might be in the pre-contemplation stage. They don't see that their issues are a problem. And so again, it can look like kind of asking very open-ended questions of, oh, when do you notice you like going to this type of behavior, right? Getting them to kind of talk about it, that can raise their awareness of what their behavior is. Impacting it you can also kind of share how you feel about the situation. Like, I've noticed that when you smoke, like it kind of bothers me, right? So then they start to become aware that their behavior is impacting kind of society as a whole. Again, there is hope. Oftentimes people feel that recovery is not possible, but our brains have a degree of plasticity. It means that it can adapt, it can make changes over time, and with treatment, lifestyle changes, many of the brain's functions can be restored, although it's going to take a long time. And that's why therapies that target both the mind and the brain, such as cognitive behavioral therapy, motivational interviewing, group support, are vital in helping people rebuild their lives after addiction. Motivational interviewing, dialectical behavioral therapy, those are very behavioral type of therapies. And so rather than focusing really on the cognitive, they focus on the behavior itself and how can we reduce the emotional dysregulation that comes prior to the trigger. So helping someone in recovery requires a lot of compassion, a lot of patience and understanding, as well as just the awareness of the resources that are out there, and how destigmatizing addiction and knowing that it's a brain disease can also help even ourselves to reduce the judgment and help them. So some of the ways that you guys can provide meaningful support for recovery is encouraging professional help. It does require a lot of professional guidance and encouraging to make this a long-term success. Offer emotional support, being available to listen without judgment, to validate their experience, and being patient can really impact their recovery. Providing very practical support, so assisting them with daily life, practical help like transportation to therapy or helping them find something or a job, encouraging healthy activities such as exercise or eating together, help avoiding triggers, especially if you know what triggers them, helping them to kind of move forward past that. Also, it's really important that people who are supporting people in recovery is that you want to promote very healthy boundaries. We want to protect not just the person, but also the person helping them in recovery. We want to stop enabling behaviors that might or enable addictions, as well as set clear limits for themselves. So letting them know how you're willing to support them, but be clear about your boundaries, especially if their behavior becomes harmful to you and to others. Educating yourself, showing up to these talks, learning more about the recovery can really help offer better support. And be able to recognize where they might be in their stages of change, where they might be in their recovery work. Celebrating milestones, celebrating small wins, encouraging self-compassion, encouraging confidence, also encouraging building a support network. All of these things can help somebody in recovery not um, uh, feel alone, but it's also important that you're not doing the work for them. You are just walking and supporting them in this journey. We want to encourage them to take ownership of their journey and create a non-judgmental support and safety. So that's kind of how we can support and recover for our folks struggling with addiction. It was a lot of information, so any questions?
Wow, that was really nutritious. Thank you so much. We'll take one question and then we'll move to Daniel's training. So the question in the chat is, I don't have an addictive personality, so I wouldn't have an addiction. Is that necessarily always true?
Um, so I think that question maybe is it kind of asking like, can some people have more prone to addiction and some people not? Um, I wonder if that can be a denial, if especially if you're noticing that they have a addiction to something, like if you can clearly see that they have a behavior or substance use that's impacting them, but they kind of respond with that. I wonder if they are in that denial stage where they're not really seeing it as a problem. So again, addiction is very complex. It's very genetic, it's environmental, it's psychological. Some people are prone to dopamine sensitivity. Some people might have more impulsivity or risk taking. So some people might really not have an addictive personality. They might be okay with that, but some people also might be more sensitive to those things. And so I guess it's not necessarily true, but if you're noticing behaviors and impact, then they might be in that pre-contemplation stage.
Thanks, Jennifer. That's a really helpful
Yeah.
framework. I'm already noticing in myself, like if I, use that framework to help understand what stage people are in and how to support. And also even for myself, like the addiction to work thing really hit home. And in terms of continuing resources, just wanted to share there's resources out there. So if you are in the Bay Area, one example of those resources are the Asian American Recovery Services. They provide a lot of in-person support for low-income communities. And we can share these slides out where it has all the details here. It's also translated in traditional Chinese Mandarin as well. And then also, if people want continuing therapy and coaching, they can reach out to Anise Health for ongoing care. So the QR code in the top left corner is if you want to speak to one of our care coordinators about your situation. And then the upper right hand is to begin our intake form. If you have any questions, you can email us at clinical@anisehealth.co. There's no M at the end. And then we also want to introduce Daniel, who is the lead harm reductionist at ADAP, which is the Asian American Drug Abuse Program. Daniel's been with the organization for 3 years, providing wraparound services to participants around LA and Long Beach. He's also an HIV and Hep C testing counselor. And so with that, we'll turn it over to Daniel.
Hi, everyone. Thank you. Useful information from the previous presentation. It was such a refresher going on the perspective as counseling, because we do have a sector within ADAP, so trying to see what they do more on the individual level and group level. It's pretty awesome on that one. Let me share my screen real quick. Perfect. Let me see. You guys can see my screen, right? Okay, perfect. Let me see. All right, perfect. Okay, so my name is Daniel Cruz with Asian American Drug Abuse Program. I'm the lead harm reductionist here in ADAP for Los Angeles and for Long Beach. Today, we're going to just be going over how to respond to an overdose, specifically opioid overdose. So I'm going to be just diving in a little bit more on what's the difference between an opioid overdose and a regular overdose. So just a little bit background about ADAP. We're a nonprofit organization from 1972. That's when we first initially started. And we do have this kind of wraparound service approach with our clientele. So originally it started with Asian Pacific Islanders because they saw there was a need for kind of support groups and again, wraparound services. And they saw that need in Los Angeles. So now 51 years later, now it expanded more to all walks of life, which various resources and programs within ADAP consist like employment services, outpatient, inpatient, residential, and even outpatient for youth as well. And so, and when it's our component is prevention unit, so that's my unit. Under prevention, we have 3 programs, but the main one that I'm part of is the health intervention program. And so within HIP, we do have this various resources, such as like what you guys are attending right now, conduct overdose prevention and education to providers, to clients, give them more up-to-date information, have like case management, which is consists of health navigation, kind of meet with the clients one-on-one to see what are their achievable goals. And we do outreach out in the fields as well, like on the riverbeds or encampments, things like that, to provide services for at-risk population. And so these are just various pictures from our outreach and one of our clients being housed as well, getting their first key. And so the main thing that we're going to be discussing about is responding to an overdose, right? And so when to respond to an overdose, you do need to identify what's the difference between one another. And so when dealing with overdose, it's mostly causing poison or poisoning effect internally in your body. So for instance, like on the picture right here, Tylenol, if you do see the new warning sign, if you do take like an excessive amount of Tylenol, you do cause some serious internal severity problems that might showcase or even explain on the warning on that box. So that's an overdose. Whereas an opioid overdose, you're leading with mostly how the presentation was talking about the dopamine kind of like effect. So that's more of the brain receptors interaction that kind of disrupts the breathing patterns, and even the heart rate too. And some key effects that we do want to recognize is that National Overdose Awareness Day was just last month, and that was August 31st. Then we have Fentanyl Prevention and Awareness Day, specifically for fentanyl, excuse me, and that is on August 21st. Then we have another National Fentanyl Awareness Day, more of like harm reduction, which kind of consists of what I'm doing as well too. More of a recognizable event that we do. Same thing, same message about opioid overdose and how to respond and be aware of what's going on with our community. And so when responding to an overdose, specifically for opioid overdose, you gotta identify what is an opioid, right? And so when dealing with an opioid, it interacts with the brain receptors, which you can see on the images on the bottom left or the center and the bottom right, where you could see an interaction with opioids and the brain receptors or even the cells, trying to create this excessive like stimulation within that brain, causing that again that reward system effect. So there's short-term and long-term effects when using opioids. The short-term effects could be kind of like slow breathing pattern. It does cause some pain relief and that euphoric effect. But when taking a long-term effect of or excessive amount of opioids, you do have that physical dependency, many kind of like depression, even having to what's causing right now an opioid overdose. And so, and also you do have three sectors of an opioid. It's broken down into natural occurring, synthetic, and semi-synthetic. So natural occurring, you do have some couple examples like opium and codeine, synthetic, which is completely lab made, which is fentanyl, and as well methadone. And then you have the semi-synthetic, which is both natural occurring and lab made, and that could consist of heroin, buprenorphine, or hydrocodone. And one of the things I do want to highlight now, since we got an idea of an opioid, is the opioid crisis. So recently, right now, on the opioid crisis is the rise of fentanyl and how potent it could be. And just due to the amount, you could just see for reference on that pencil at the very tip or even at the penny, that is the lethal amount of dose to cause an opioid overdose. And it could come in various forms. It could come in powder. It could come in pressed pills, such as like what you can see on the right-hand side. So recently during the summer or kind of like this in season for raves, we do get a lot of influx of people wanting to get fentanyl test strips and Narcan. And so occasionally it is the younger folks that we interact with. And they're, yes, the social media does promote about the fentanyl overdose, but kind of like the not very aware of where to obtain these kind of resources, right? They hear about fentanyl all the time, but they want to test their drug, which is nice. And so evidently at times, if they do want to see how to use this kind of preventative measures, I do have some ways for you guys to test or to obtain fentanyl test strips as well too. But fentanyl is a very dangerous right now due to how it could easily be blended with across the board. Especially with cocaine. Although cocaine is not an opioid, but mixed with fentanyl, it does cause it leading to an opioid overdose. One thing too, I do want to keep in mind, and just to let you guys know, you probably heard about fentanyl might be going through your skin or not. That's a misconception. That definitely does not go through your skin. You actually have to be taking that kind of powder or that substance. And they do come in patches too, but those are medically prescribed due to some severity, kind of like cancer patients or leukemia, things like that, kind of more severity, they lead it to that. But at times too, you want to be aware that at times they kind of sell those patches. I had clients that they inform me that they sell these patches, they rip it apart and they sell it out to other participants. I've heard that before. But also too, specifically, is a lot of the now with the Ray individuals or the Ray family, they're being more aware about the fentanyl. I want to get resources how to test it. And I will definitely let you guys know how to test it too. And I do want to show some warning graphic sign. This next picture is very graphic. It is some consequences when using Trank. So that's another thing that's leading right now. Trank is a horse tranquilizer and it's not an opioid. So unfortunately, if someone's leading to that kind of like overdose, unfortunately, Narcan won't work. We're still unaware about mix with fentanyl and Trank, which is a horse tranquilizer again. Again, we're not 100% sure if Narcan or naloxone would work on responding into an opioid overdose. And I do want to state that as well. So as you could see here on the pictures, this is kind of like the sites where they do injections or some kind of like ways they inject one part of the area and it travels to another area. So like an abscess, right? And so you could see here on these pictures, some consequences or the aftermath when using tranquilizer. And you could see on the bottom left picture, the skin grafting. And so trying to bring back that kind of living tissue. So I haven't seen this out in our when doing outreach, but this is kind of like what you would probably be hearing about, the zombie drug. That's one thing you might hear about, or the flesh-eating disease, or like again, trank, just the word trank. So listening to those keywords or those kind of like language kind of will help you kind of dig in a little bit deeper what's going on and with the community. Because I too asked with my participants, pretty straightforward what's going on with the community. One thing within California, I do have some data with California and LA County. Overall, opioid overdose, specifically on the death rate, has been doubled or even not tripled within California. And it's mostly due to some factors such as unhoused individuals and as well as specific demographics like Native Americans, Black, and Latinx. And so you can see here on certain bullet points on the right-hand side, it's due to probably a shift of drug use. People are probably using from injection to smoking. Another thing is just inadequate or lack of housing. And another thing for accessibility with medicated opioid use disorder or MAT services, medicated assisted treatment programs. And so with addition to the California data, the main thing I really stuck out for me from this flyer alone was the fatal drug overdose are now the top 10 causes of death in California. And so that alone just kind of opened my eyes to see when the reality in California, seeing that it is top 10, it's pretty scary. In addition, with the fentanyl overdose deaths by age within LA County, you could see the rate. This helps us to see how we could target our population in terms of outreach efforts. Primarily, the main takeaway here is the rate of population per 100,000. So it kind of breaks down on the age group between 18 to 39. So you can see the high rate on that age group or age gap. It's really high. And so that helps us to shift our outreach efforts to really focus on responding to the opioid overdose efforts. A little bit as well with demographics. It has increased. You could see slowly shift towards up. But one of our kind of concerns or kind of conception is probably because of COVID, right? Everyone was indoors or out in the field, nothing much to do, or some challenges has faced when responding to COVID. People lost their businesses, became unhoused, and so many factors have played into effect with that one. Then overall naloxone. So a little bit of xylazine, a little bit of fentanyl, now with the naloxone, how to respond to it. Naloxone is the medication. Narcan is the brand. So I just do want to highlight that. And with naloxone, it only works with opioids and it interacts with the brain receptors, which basically knocks it off from the brain receptors and filling in with the medication hopefully bringing back to your body like breathing patterns, heart rate back to normal. It is a non-scheduled drug, and it could be administered either via nasal or intramuscular. And it does have a shelf life between 2 to 3 years, but if it has an expiration date, you still could use it with an additional 5 years max. So with naloxone, reiterating, it only works with opioids. So this is just a basic list on generic and brand names on opioids. And so all the names here, you could see the way the naloxone will react to it. So the images on the right-hand side, you could just see briefly how naloxone reacts with the opioid receptors, how it just knocks it off. And so when naloxone is being administered nasal or muscle, that's the whole chemical reaction happening regardless of that. So when identifying or being able to know what is naloxone is and how it could be administered, we want to see what ways physically on how to be administered. So one of us, we do carry these naloxone bags, various forms in different colors just to make it stand out. And so the first one you could see is intramuscular. So when it's given like that, you will have like 2 vials going on, very small, like this. So what you would do, you would just prop this purple thing open. And where you see that little center, you would just grab the needle, which is very long because it's just because it's being administered via muscle area. And so what you would just do, insert the needle into the vial, just drain the whole liquid, which is just 1 dose. Oh, you can't see it. And just prepare it in terms of like pushing it really close, like Nurse Jackie. And if there's any air bubbles too, don't worry about it. It's being administered by muscle. I thought that was going to be a conflicting factor since air bubbles, but that's only applicable for being administered through the vein, so the IV. And so you do have to administer it in the bicep, triceps, thighs, or even the buttocks area. And you do want to wait roughly 2 to 3 minutes before administering the next naloxone. So that's just the muscle. Seems a lot, but we have our preference. Well, not my preference. My preference, I could say, is the nasal because it's easier. And so, so what you would just do, just prop this open, peel it in the back, and take this out of the container, and you just insert it up in the nose. Same nostril or in this, either or, and you just press the little plunger, the color plunger, and it will lock. And the same thing, wait 2 to 3 minutes before administering the naloxone. And that's it. That's just those 2 methods are 2 ways to administer naloxone. So once we got an idea now how to administer naloxone both ways, it's just really now how to respond to it. To really respond to an opioid overdose, keep in mind you are protected by the Good Samaritan law. So I know people would say, I don't want to respond to an overdose because I might go to jail or just because of other cofactors. Keep in mind, again, with the Good Samaritan law, if you're responding to an overdose or even just a car accident as well, and you see people needing some help, you're protected again with the Good Samaritan law in case that person is trying to go sue you due to being injured or any type of like issues along while trying to help that individual. So step 1, you got to recognize the signs or stimulate. So these are common signs for an overdose. One of the key things is not responding. So you could just rub the sternum with your fist and just keep rubbing up and down. If they're not feeling that pain, that's one of the signs to be leading to an overdose. One of them could be cold, clammy skin, tiny pupil eyes, or the bullseye, blue fingertips, and as well lips. And another thing is the slow or not breathing and the making sound. So don't get it confused when someone might be snoring, because that has happened before where an individual, unfortunately that person is not here today, but with the mother thought that son was sleeping, and unfortunately, that individual was having an opioid overdose. And so, unfortunately, um, due to that kind of like misconception, that led to an opioid overdose. So one of the things to keep in mind, it's okay if you're rubbing on the sternum, shake them a little if they're not responding to them, but just don't doubt yourself or fully go on with just assuming that it's going to be snoring. But if you see that also some other cofactors as well, the blue fingertips is a huge giveaway, and the blue lips, that's a big hint to that being an opioid overdose. There's a difference between an overdose and being high as well. So when someone's under the influence of, for instance, marijuana, they do have a normal heart rate. They could be responsive. They could be slow at times and slow slur speech. Whereas someone with an overdose, they're not really responding, very cold, clampy skin, even, again, unresponsive. So this is just some signs, differences between being high and overdose. Once you recognize the signs of an overdose, whichever you have accessible with for naloxone, either nasal or intramuscular, do the same proper method, peel a package, insert the nasal or the medication inside the nostril and press the plunger, or the injectable, prepare the vial and insert it either bicep, triceps, thighs, or buttocks. So once that administered, you could administer a second naloxone within 2 to 3 minutes after the first one. Once that's done, there's certain protocols that may be done internally within an organization. Do follow those, but in terms of community members, we do like to emphasize when responding to an overdose, when calling 911, we don't say it's an unresponsive individual due to the sole reason it's the stigma. And so when saying due to like, hi, 911, can you send the paramedics? And they ask why, it's because of opioid overdose. Mostly due to our clients, other feedback, they've been saying that the police get there first rather than the paramedics. And so that's kind of like the big no-no, and also one of the cofactors leading to like people not wanting to respond to an overdose because of that. And so we really emphasize on stating, hey, it's an unresponsive individual. I just found this person unconscious, I don't know, unresponsive. Can you send it out? And they're persistent asking, just say it's an unresponsive individual. Mostly all the time, based on that, clients too have been telling us the paramedics get there first from there. Step 4 is the recovery position. This recovery position just solely helps them prevent them from choking, or even like if they ate something or trying to gargle. So this prevents them from choking overall. All you got to do, if you can, too, if they're laid on the back, just raise one arm, then put it against their chest area. Then after that, with one arm, lift the leg towards you, and then where you could just put that body on or that person on their side, just to make sure if the airway is open and just nothing blocking it as well. If that's not doable, that's perfectly fine. I know this is sometimes it could be challenging, but do make sure nothing's blocking in their airway. Then step 5, do self-care. I know it was a lot when responding to an overdose. So keep in mind just to treat yourself in terms of like, maybe you do need to step aside, I let my staff to step aside, or even if they do need to take a day or a couple of days off too, just because of a traumatic event, I'll let that be, because it could be, it's scary. It really can be scary. Then lastly, where to obtain Narcan. You could obtain it at a local pharmacy, either prescribed or buy it off the counter, or not off the counter. But it could be pretty pricey, within 40 or 80 bucks, just for 2 doses of medication. But you could just obviously get it at like a local harm reduction, or even just look up syringe services programs. So if you're located in San Francisco, I know there's plenty of SSP programs there. And so they're more than welcome if you can reach out. You can obtain naloxone from them. Another thing too is like my department, we give out naloxone, which I saw on the comments here, my background for the naloxone. So yes, we are the one providers to provide naloxone. This is just a little video on this. You can find on YouTube here, but I'm going to share the slides too. So if you do need to look back to it, you're more than welcome to play this video. And lastly, touching back with the fentanyl test strips, this is the one thing I was regarding back to, like how the rave individuals want to test their drugs. This is one great way to test overall if there's any kind of interference with their substance or their drug, specifically for fentanyl. So this fentanyl test strips are originally meant for urine tests, but we see that it could be used for testing your drug. So they come out like in these kind of like test strips. What you would do, either there's two methods. Mostly the common one is the penny method, is where you would crack a little bit of your dope, for instance, a pill, and you would just cover the powder form of the pill over Abraham Lincoln's hair, and that's your measurement or your sample size. And then you would just get a cup or a bottle cap and put 1 or half a tablespoon of water, depending on the substance that you're going to be testing for. And lastly, you would just get these little test strips from the, excuse me, it's hard to open it. The little thing here, and you could see whether or not from the back, they will tell you whether or not if it's a positive, negative, or invalid. Due to some reasons, if you do get an invalid reading, it's just because it was too much water or not enough dope or substance to test for it. Then lastly, just some information on and resources where on harm reduction. I'm also part of the Harm Reduction Coalition support group. So this is where we could get our resources or even information up to date overall. And yeah, and I do want to mention too, lastly, a main takeaway. I was quite shook when I first heard about this. Never use alone. So this is a hotline for individuals if they're going to be using by themselves. There's an operator at the other end for them to respond or send medical assistance for an opioid overdose. And yes, that's a wrap, you guys. Thank you so much.
Thank you so much, Daniel. I appreciate you so much. I'm gonna stop recording really